Hi friends, I am Dr. Rajat और मेरे साथ है Dr. Astha. She just completed her clinical endodontics training for 6 days and let me congratulate you first of all Dr. Astha for completing your endodontics training. Being an orthodontist, you are now proficient in endodontics. You have treated a lot many cases here. How is it working here on patients and with your endodontics training?
It was really good to work over here and I learned. Actually, I have been practicing endodontics since long time, but it was really good to learn the new techniques like the endomotor, pro tapers, path files, retrieval files, and lot many things over here. It was really good. It was fun. The good staff over here, very friendly people, and absolutely, sir, you trained me very well over here.
Thank you.
Thank you, sir.
6 days of Rotary Endodontics training started with diagnosis and importance of pre-op X-ray, the importance of pre-endo build-up, excess cavity preparation and refinement, the indications of the traditional access, glide path scouting of the files from manual to rotary, how to locate extra canals like middle mesial or MB2, techniques of using orifice openers for removing the dentinal triangle, importance of SX, high flex EDM, achieving super glide path files from profinders to path gliders to profinders, different canals, preparation of different file systems, importance of recapitulation and patency fillings from irrigation, the canals, from activation, the irrigation, the opening and the lateral canals, the accessory canals from isthmus to apical delta, role of intracanal medicaments, calcium hydroxide, from curved canals to ledges to perforations to internal and external resorption, periapical lesion working on microscopes, pulp stones, calcified canals, bypassing broken instrument using of ultrasonic, using of pro ultras, managing confluent canals, open apex canals, reroot canals, endoperio lesions, hot tooth, role of MTA working on MAP, biodentine in endo, hypochlorite accidents, tips for recording and documentation of cases, working on 15 successful live patient root canals, documentation and case discussion for around 25 cases, acting of which file system to be used, working on pro tapers, achieving 3D obturation, apical puffing, working on 3D obturation using backfilling, down packing, working on different canals, importance of pro taper, step-by-step obturation techniques, from isolation to quadrant isolation, single tooth, inversion of rubber dam, post and code build-up, working on Paladin, working on BioClear, and removal of GPs from D1D to D3. Successfully completed Rotary Endodontics training. Dr. Astha, wishing you all the best. Being an orthodontist, you chose Rotary Endodontics training under us, and I want to congratulate you for successfully completing all the 15 cases on the live patients, and I'm wishing you all the best. Endodontics isn't difficult, but if you manage it successfully, if you manage the canal anatomy perfectly, it'll be very easy. So keep doing endodontics, and I'm wishing you all the best. Keep sharing your cases. Thanks a lot.